Good afternoon. That sounded like a moment of silence. I wonder for what. And this is the awkwardness sometimes, as persons with disability, you experience. You show up in a room and it goes silent and everybody's figuring out, so how does she get up there? Anyhow, my name is Oywaya, like you had. I am a road safety advocate and consultant. About 3 decades ago now, I was a very young banker. Life was just beginning, looking up. Those days, those who lived in those days, getting a job at the bank was a big time thing. And my life is figured out. And one day, I'm with friends, and we are headed to Mombasa, and we get to a place called Voi, right midway. And there, 2:30 p.m., thereabout, we get involved in a road crash. And that was the beginning of a new chapter of my life. I injured my spine. And I always say that I'm one of the longest sitting people around because I've been sitting for the last 20-something years, almost 30 years now. I moved from the bank. As you heard, I was a banker then, and began to ask myself questions because the environment was not friendly. Everything I needed to do was not smooth. I needed to wait to go to the bathroom because the bank did not have accessible bathrooms. And every time I needed to use them, I had to get transportation back home or somewhere close and come back. So it wasn't possible to go on like that. So I went out and I began to do things that were more relevant to the situation that I'd gotten into. And I quickly began to realize that public transport was very inaccessible for a person using a wheelchair. For those that don't have the privilege of seeing me, I can't call it a privilege, who are seeing differently, I use a wheelchair, have had a spinal cord injury, and therefore I lost the use of my lower limbs. And I also discovered that public transport was actually the key to independent mobility. I took so much for granted. And every time I needed to move from one point to another, it was a public announcement. Somebody needed to take me, So I was relying on the benevolence of colleagues, of friends, of people, and that life was very, very, very stressful. So even as it is now, almost 3 decades down the line, we are still dealing with the same issues. And we are still seeing that public transport clearly is not designed or operated with persons with disabilities in mind. And what does this even mean? It just means that there's a population that is totally excluded. There are children that will not go to school because some schools are not accessible. Parents are not able to get more expensive transport to take them to school. We know that there are people who quit work. I was one of them who quit work, but for different reasons. Just it was not sustainable. But at least I had the brain to go and do other things. There are people who can't even access hospitals, social amenities, and this impacts the quality of life like it did for me. All of a sudden, I discovered that my friends weren't calling me for stuff. They weren't telling me when their birthdays were, because how will we get her there? And I became a burden. And as you can see in that picture, that's a friend of mine. She has cerebral palsy, and she allowed me to use that picture. She's trying to get into a matatu. She can't use her hands. She's posing there just because she needed to take that picture for me to use. But otherwise, she would have been assisted to get up there. And we'll talk a little more about that. So where did I find the gaps, and where am I finding the gaps? Gaps in policy. And as much as many people say here that we have enough legislation, we have enough policy, yes, we have some. And it's been alluded to. We've ratified the Convention of Persons with Rights to Disability. We have a Disability Act of 2003. Our Constitution expressly talks about inclusion, but yet, here we are in this century, in this season, still living at the mercies of other people. I found gaps, and I continue to see gaps in planning, designing, and implementation when it comes to transport infrastructure, for example, transport facilities. That persons with disability are an add-on when it comes to policy discussions. And we are added on to tick the box. How many did you include persons with disability? The constitution requires, but I don't believe there's any intention of implementation because we wouldn't be here 3 decades later. A good example is just this hotel, and Gail was alluding to. I made a very conscious decision today not to go for lunch because yesterday was such a hassle, and I asked myself, between all that hassle and just feeding my stomach, I guess nobody has died for missing one meal, so I passed the lunch. And I began to ask myself, how many people have passed on other important matters just because they made the same considerations that I made just over a meal? Maybe it's over school, maybe it's over other major decisions. The other area I have found gaps is enforcement. Yes, we have some laws. Yes, we have some policies in some sectors. We have the national transport policy, but implementation is very weak, and sometimes it's lacking. We face various barriers, including cost of transportation. And now that we're talking about inclusion or exclusion, maybe I should have talked about exclusion in the transportation system. If I have to use a public transport today, I would need an assistant, and I'll have my wheelchair. And the typical buses that we use in Kenya do not have provision for wheelchairs. So what that means is I'll pay my fare, I'll pay my attendance fare, and I'll pay fare for the wheelchair because they'll say, where do we put it? It doesn't have a carrier. So I'll pay 3 fares for one journey, while you'll pay 1 fare for the same journey. Those are just the hindrances that we come across. And that means we just rely on more expensive travel options. And that there's an assumption that maybe we could afford it, but many people cannot afford it. So they make the options like I made at lunchtime, not to travel. And so they're cut out from their social activities. There's also the attitude. I know friends of mine working with the organizations I've worked with, and I work with the Association for the Physically Disabled of Kenya, where I'm the vice chairperson of the board. I've worked with Kenya paraplegic organizations, many organizations I've worked with. And I know these are sentiments from real lived experiences. There is a lot of time we waste at the bus stops. If you can't afford the more expensive Uber or any other, then you wait at the bus stop. If it's rush hour, woe unto you. You will have to wait for a kind driver and conductor. Otherwise, you'll be looked at as an inconvenience because that's the time these buses make most of their money. The attitude, the names you're called, it is in the public space. So everything we've discussed this far, and I've been listening, that affects the everyday person, the everyday woman, the everyday child, is twice as much for a person with disability because we have extra baggage as they see it. People have been harassed. I know a friend of mine who took an Uber and they ended up in the wrong place. Thankfully, they were not defiled because there was intervention that came, but just because if you keep my wheelchair in Kenya, we call it the boot. I don't know what other people call it. That's it. I will sit there until you give me back my wheelchair because it's my tool. My symbol of freedom is my tool of movement. And so the boot, the wheelchair was in the boot. They are seated at the back seat. There's nothing they could do. They can't run away. They can't jump out. But luckily, for this particular one, they were not defiled. There are also environmental issues when there are floods, and we've experienced floods just recently here in our country. People with disability, whether it's visual, whether it's physical, navigating the waters can become a very serious thing. And then there's pollution because of lack of provision for infrastructure. We use the same routes as cars. So the same vehicle in my case that put me on the wheelchair is the same transportation system that makes it difficult for me to survive is the same one that's polluting me and causing health hazards to me. So it's a whole vicious cycle. And like I said before, it affects the quality of life, health, well-being, freedom. And I was such an independent being and creature. So I'm really constrained when I have to depend on other people. Physical barriers are a big thing. The first photo, you see how cars park, where there's provision for walkways and wheelchair movement. Somebody will find that to be the most convenient place to park. And this photo was, I took it from Chris Cost of ITDP. He had posted it on his Twitter handle. Traders also, as much as we need traders, we need people to economically do their thing, but there needs to be a realization that we share these spaces. And therefore, there must be very deliberate effort to ensure that we all can share the road. He lives on that side of the road where he is at. For him to cross to the other side, there is a bridge with a ramp, but it's useless to him because it's blocked. And therefore, these are just some of the everyday barriers and hindrances that we have to deal with as we arc a living in our cities. The cases in the rural areas, I cannot even begin to explain. Roads with incomplete walkways or dangerous potholes or open gutters, as you can see, are also another challenge that we find every day navigating. There are so many times I have celebrated that I found a walkway only to come to an abrupt end, and I have to make the long journey going back so that I can now drive, do I drive or walk, on the road where cars are. So what then after all this? I think there is need, and today, earlier we talked about data. There's a problem with data. In our country, Kenya, we are not even sure we know the number of persons with disabilities. We just ended the National Disability Conference last week, and one of the arguments that were in that conference, how many persons with disabilities are there? We have had census in 2009, and we discovered that according to that census, there were 3.5% of the people had some form of disability. Come 2019, they had reduced to 2.2 million. What happened? Did they die? Something is not right. WHO tells us at least up to 15%, 10 to 15% of any population will have people with some form of disability. So if we don't even get the numbers right, then who are we planning for? We can't plan correctly. We also need to embrace inclusive culture and mindset. This is what I'd call the universal design mindset. And I think it's Senator Crystal that said earlier, when you plan for people with disability, you have actually planned for everyone. Everyone will be able to access, and it makes life so much easier. We need inclusion in planning, designing, implementation, like I said earlier, because we understand what we need more. I'm sure the person that was doing the ramps around, if they worked with a person with disability or a person on a wheelchair, the story would be different. And it's also possible to have very low-cost interventions. Whenever we think about interventions, we think of big budgets. Not so. Let's just start by removing obstructions on footpaths, for example, implementing that. Bus stop levels that are accessible. Easy to flow and audible route signs for those that are deaf. Let's just start by the things that we can do very simply with no budget additions. Accessible vehicles. It's a shame that in my country, up to now, we still don't have accessible vehicles 60 years after independence. So inclusive transport should not be treated as an accessory, something you just put on and put off or decide or not to decide. It is part of the main transport system. It's not an add-on. It's not a retrofit. Persons with disability are tax-paying people, and therefore, the right to access, the right to exist, like was said earlier, is inherent. So we truly need to apply these universal access principles. And I conclude by saying availability, accessibility, affordability, and safety are key to inclusion. And I thank you.